I'm Olivia Roche, and I'm the SLB for the Adult Acute Care Unit. Our volunteers play a crucial role in assisting our healthcare team in providing exceptional care for patients with a wide range of diagnoses, including diabetes, wound management, respiratory diseases, and those recovering from various surgeries. Some patients are long-term, while others are short-term, allowing you to build meaningful relationships with both staff and patients alike. On 2J, you'll help ensure unit efficiency through diverse duties, from conversing with patients and assisting nursing staff to transporting patients and restocking supplies. This is a great opportunity for volunteers looking to gain direct patient care hours. We're looking for individuals who are self-motivated, outgoing, and compassionate. Volunteers are needed 7 days a week from 8 a.m. to 7 p.m. Thank you.
Patients on the Adult Stem Cell Transplant Cellular Therapies unit are very immunocompromised and only receive limited visitors during their stay. Many patients are on the unit for weeks to months at a time, which is one reason they absolutely love visits from our volunteers. Volunteers on 3JCP are responsible for hourly patient rounding, patient interaction, staff-directed tasks, and running hospital errands. Volunteers on this unit should be outgoing with good communication and interpersonal skills. They also must be self-motivated and independent in finding tasks to complete. Shifts are available from 8 a.m. to 7 p.m. every day of the week.
The Ambulatory Surgery Center is an outpatient surgery unit located within the Pomerantz Family Pavilion of the hospital. Volunteers in the Ambulatory Surgery Center work closely with the nursing staff, assisting with duties such as patient transport, patient repositioning, providing company to the patients after surgery, in addition to their general cleaning and restocking duties. The ASC is a fast-paced surgical care unit with lots of patient interaction, so volunteers in this unit must be self-directed, able to work independently, and possess strong communication skills. The ASC is a great fit for students with pre-med, pre-nursing, pre-physical therapy, or pre-dentistry interests. Shifts are available from 10 a.m. until 7 p.m. Monday through Friday.
The burn trauma unit cares for adult and pediatric patients with various types of burns and traumas. The BTU is one of 62 burn units in the country and is the only one in Iowa. The unit cares for patients from all over Iowa and nearby states. Volunteer help on the BTU is essential for helping staff provide the best care possible for our patients. While volunteering on the unit, you will work closely with nursing staff, physical therapists, and occupational therapists to assist in important tasks. Volunteers also help round on patients, sit and talk with patients, and keep work areas well stocked. Opportunities are available to observe tub bathing, dressing changes, and re-soaking procedures.
Hi everybody, my name is Nathan Steimel and I'm the Student Leader Board Member for the Cancer Inpatient Unit. The Cancer Inpatient Unit is an oncology inpatient unit at the University of Iowa Hospitals and Clinics. On this unit, volunteers assist the healthcare team in its care for patients recovering from surgery, chemotherapy, and radiation. As the duration of stay for many patients ranges from days to weeks, the primary responsibility of volunteers is to provide emotional support and stress relief to these individuals. Additionally, volunteers ensure unit efficiency by stocking and cleaning rooms, maintaining organization of medical supplies, and assisting environmental and nursing staff. Due to the high amount of patient interaction and independent work expected from the position, volunteers must be self-motivated, outgoing, compassionate, and willing to communicate empathetically with patients. Shifts are available all days of the week from 8 a.m. to 5 p.m. Volunteers will be expected to spend at least 3 hours per week on a unit.
Cardiology unit is a heart and vascular center focused on both the recovery and long-term care. Volunteers serve a critical role in this unit by assisting with environmental aid and other staff members, from stocking supplies to helping care for patients in the unit, and occasionally transporting patients to other locations in the hospital. Our unit provides volunteers with a chance to experience a patient interaction. Volunteers in this unit are advised to be able to work independently with both strong and assertive personalities. Volunteers must be able to communicate with both patients and staff members and their families. It is essential that volunteers in this unit are reliable and make it to their shifts throughout their volunteering commitment. The volunteer dress code for this unit is a volunteer services polo, khakis, and closed-toed shoes. Hours are available on this unit from Monday, 8 a.m. to 8 p.m., 7 days a week, Monday through Sunday.
The Cardiovascular Intensive Care Unit is a pre- and post-operative care unit with 24 beds. Volunteers in this unit have the opportunity to interact with patients, from assisting them in walking to transporting them around the hospital. As a critical care unit, a volunteer that would be a good fit for this unit is someone with strong communication skills and a friendly personality. This unit is a great way to interact with the clinical team, such as nurses, physicians, and physical therapists. The CVICU welcomes volunteers 7 days of the week from 8 a.m. to 9 p.m.
Hi, my name is Mia, and I am the SLB for Center for Disabilities and Development. The CDD is a unit that cares for patients with disabilities and their family members and provides various services from therapy to medical appointments and more. Volunteers primarily work to fulfill the needs of patients and their families. This can be accomplished in many ways and may look like offering companionship to children and their families, escorting patients around the CDD, and organizing and cleaning toys. Volunteers should be independent, self-motivated, and dependable. Apart from the amazing pediatric patient interactions, volunteers also get to work closely with occupational and physical therapists, speech-language pathologists, social workers, nurses, PAs, and more. Shifts are available Monday through Friday from 9 a.m. to 4:30 p.m.
Hello, my name is Mia Schrader, and I'm the SLB for Child Life. Levels 9 and 10 of Stead Families Children's Hospital cares for children of all ages with various conditions. Child Life volunteers have the opportunity to play with patients, bring them toys, read to them, and participate in any Child Life sponsored activities like birthday parties and crafts. Volunteers also help to clean toys and keep the playroom stocked and organized. The unit is open to volunteers Monday through Sunday from 9 a.m. to 6:30 p.m.
The Child Adolescent Psychiatry Inpatient Unit offers a very dynamic and engaging volunteering experience. Volunteers typically assist as a behavior manager in small group situations with children who display a variety of psychiatric disorders. They work individually with students, helping them on educational assignments, providing basic instruction on various subjects, and assisting with crafts and games during activities. Attendance is vital because staff greatly relies on their volunteers. The unit welcomes volunteers Monday through Friday from 9 a.m. to 12 p.m. or 12 p.m. to 3 p.m.
Hi, my name is Meredith Sloat. I am the SLB for Cornea Clinic. Volunteers in Cornea Clinic complete various tasks such as transporting patients, making packets, running hospital errands, and helping out with administrative tasks. In this role, volunteers might get opportunities to work directly with physicians. To join the Cornea Clinic, you must have a minimum of 30 hours of volunteer experience at UIHC.
Hi everyone, my name is Brianna Blaine and I'm the SLB member for the Emergency Department. ED volunteers will have the opportunity to observe incoming traumas, help assist staff with various duties on the unit, and tend to patients in the ED and in the waiting room. We are the only level 1 trauma center in the area, so this is a very unique opportunity and we would love to have you.
The goal of the Geriatric Psychiatry Unit at UIHC is to improve the patient experience in one of the few inpatient geriatric psychiatric units in the country by aiding staff and providing diversions for the patients. Patient populations include those in acute states of behavioral crisis, often suffering from dementia, Parkinson's, and Huntington's disease. Examples of what volunteers may observe include dressing changes, catheterizations, and ostomy care. This unit offers a fantastic opportunity to develop therapeutic communication skills with neurocognitive disorder populations and develop skilled diversion and distraction techniques.
Hi everyone, my name is Connor Wettig and I am the SLB for Guest Services. Guest Services volunteers aid in the transportation of patients and visitors around the whole hospital. Specifically, volunteer transporters assist in transferring patients to clinic appointments via wheelchair or walking with them. Additionally, volunteer transporters deliver patient belongings to inpatient areas and assist guest services valet staff with any needed tasks. Shifts on guest services are available from 8 a.m. to 5 p.m. Monday through Friday.
Hi, I'm Mia, and I'm the SLB for the Main Operating Room Electroconvulsive Therapy, or ECT. The ECT is a unit that cares for patients after undergoing the ECT operation and may be in a very vulnerable state. Thus, it is crucial for volunteers to be gentle, compassionate, and kind to these patients. Volunteers will work closely with nurses to turn over beds and clean equipment. Volunteers also have the opportunity to shadow ECT procedures and work closely with staff. Shifts are available Monday, Wednesday, and Friday from 9 a.m. to 1 p.m.
The main operating room is divided into 2 subunits, the OR, or the operating rooms, and the core.
Volunteers in the OR work alongside staff to help clean and turn over operating rooms in between surgeries. This typically includes wiping down surfaces and helping set up for the next incoming surgery while working closely with nursing staff. Volunteers in the Corps help with the organization and preparation of OR supplies. Tasks include looking through inventory, cleaning, and scanning instruments. Volunteers with 20 hours in either subunit can observe a surgery or procedure of their choice. The MOR is a good placement for those less focused on patient interaction but have a strong interest in healthcare and want to get introduced to the fast-paced OR environment. Volunteers should be able to work independently and follow OR precautions. The OR is open from 10 a.m. to 7 p.m. on weekdays, with the Corps offering additional shifts on weekends from 12 to 3 p.m.
Hi, I'm Mia, and I'm the SOB for the Main Operating Room Second Stage Recovery Facility, or SIRF. SIRF is a unique unit that provides outpatient post-surgical care to patients who have undergone surgery that day. Volunteers must be friendly, helpful, kind, and efficient. Volunteers help turn over rooms by cleaning equipment as well as stocking. They also get to greet nurses and patients as they come out of surgery, help transfer them to the room, and fulfill patient requests. Lastly, they also help transport patients to their car once they are discharged. This unit provides a great opportunity for hands-on direct patient interaction. Shifts are available Monday through Friday from 10 a.m. to 8 p.m.
Hello, my name is Mia Schrader, and I'm the SLB for the Medical Intensive Care Unit. MICU volunteers have the unique opportunity to work in a setting for critically ill adult patients and interact with the staff on this unit. Volunteers will sit with patients and family members, stock patient rooms, and work alongside nursing and nursing assistant staff to meet the needs of patients and the unit in general. Those interested should be self-motivated and personable. The MICU is open to volunteers Monday through Sunday from 8 a.m. to 11 p.m.
The Medicine Specialty Unit is an inpatient care unit located on the 6th floor of the Roy Carver Pavilion. Volunteers on this unit work both independently and with nursing staff to improve the hospital experience of patients. Volunteer duties range widely and include conversing with patients, playing games, going on walks, assisting the nursing staff, transporting patients, restocking, and other clerical duties. Volunteers must be able to communicate and interact with patients of all ages, recognize and work around physical limitations, be aware of safety factors, possess good judgment, work independently, and be self-directed. The Medicine Specialty Unit is best suited for those with a pre-medicine or pre-nursing interest. Shifts are available from 8 a.m. to 8 p.m. 7 days a week.
Hi everyone, I'm Brianna Blaine and I'm the SLB member for the Mother Baby Care Unit. MBCU volunteers will have the opportunity to help nurses and nursing assistants with various tasks across the unit, talk with and meet the needs of both our new mothers and our expecting mothers on the unit, and hold babies on the unit if they feel comfortable in doing so. We would love to have you.
Hey everybody, my name is Ellie Johnson and I am the SLB for the Clerk and Sibling Support Volunteers in the NICU. The Neonatal Intensive Care Unit, or NICU, is a unit that cares for premature infants. Our CSS volunteers assist the nurses and unit clerks at the front desk, allowing them to become familiar with the NICU and its unique characteristics. Volunteers also interact and play with NICU siblings. The CSS volunteers' main responsibilities include working with child life specialists to provide support through play to siblings of NICU patients, answering phones, screening visitors, directing family concerns to nurses, and assisting with the NICU Books to Babies program. It is the perfect way to get your foot in the door if you hope to become a developmental care volunteer. Hi everybody, my name is Ellie Johnson and I am the SLB for the Developmental Care Program in the NICU. The Neonatal Intensive Care Unit, or NICU, is a unit that cares for premature infants. Developmental care volunteers have the opportunity to hold babies, read to them, talk and play with them, and assist nursing staff with caring for the infants. These interactions provide positive touch and comfort that aid in the development of the patient. Volunteers interested in developmental care must have a minimum of 40 hours of volunteer experience at UIHC. Volunteers must also be 18 years or older.
The Neuroscience Intermediate and Inpatient Unit are to assist staff with functional and patient transport. Some typical duties of volunteers on this unit include visiting with patients, assisting nursing staff with patient bathing, escorting patients to different areas of the hospital, unit deliveries, clerical work, and cleaning. Potential volunteers should be comfortable with having large amounts of patient contact throughout their volunteer shift. Also, volunteers are expected to be self-motivated in this unit as it may become very busy at times, especially with patients being admitted into the unit. Responsibility is paramount for potential volunteers as he or she may be exposed to confidential patient information. There are typical opportunities to shadow nursing staff, EEG technicians, neurologists, and neurosurgeons. The uniform for this unit and dress code is white volunteer polo with khakis, and training is available from Monday through Friday, 7 a.m. to 8 p.m., or Saturday and Sunday, 10 a.m. to 6 p.m.
The Orthopedic Trauma and Spine Unit is a fast-paced unit that sees a wide variety of orthopedic, surgical injuries, and trauma cases. Volunteers on this unit will interact with patients in an inpatient unit, stock patient rooms, and work with the nursing staff. Volunteers will prioritize patient interaction, patient rounding, and staff-directed tasks. Volunteers in this unit should have excellent communication skills, be outgoing to speak with patients, and be self-motivated to find new tasks. Shifts are available Monday through Friday, 10 a.m. to 7 p.m., with volunteers most needed from 4 p.m. to 7 p.m., and Saturday and Sunday, 4 p.m. to 8 p.m.
Hi, my name is Meredith Sloat, and I'm the SLB for the Palliative Care Unit. Patients seen by the Palliative Care team have challenging symptoms, difficult decisions to make, or have ongoing grief due to losses from their serious illnesses. They may vary from conversational and going home to the acutely dying process. Volunteer tasks in the unit include providing one-on-one companionship for patients who are alone and may benefit from having someone to read to them, talk with them, or offer support by simply sitting quietly with them. Volunteers can also help by giving guidance about hospital resources both to patients and their caretakers.
The Patients and Children's Library provides a variety of different entertainment sources to patients and families within the hospital. This entertainment comes in the form of books, movies, laptops, video games, and even craft kits that the volunteers make during their shift. As a volunteer, it'll be your job to deliver these goodies to the patients and families all around the hospital. This unit consists of 2 different libraries, the Patients Library and the Children's Library, with each of them welcoming volunteers during their full hours of operation. The Patients Library is open from 1 to 4 p.m. Monday through Saturday, while the Children's Library is open from 9 a.m. to noon Monday through Friday, along with 1 to 4 p.m. on Sundays.
The Pediatric Intensive Care Unit, or the PICU, is a unit that provides inpatient care to critically ill or injured infants, children, and teenagers. Volunteers on this unit can interact with patients on the unit by providing diversionary play to patients and siblings, giving families a tour of the unit, and cleaning and organizing playroom toys. Volunteers can also help with the organization and distribution of the Ronald McDonald House family room supplies within the hospital. The PICU is best suited for dependable, outgoing volunteers who are comfortable with pediatric patients. Volunteers must possess good communication skills and be able to work independently.
Hi, my name is Meredith Sloat, and I am the SLB for the Pediatric Ophthalmology Unit. This position is a blend between a volunteer position and a physician shadowing position. Volunteers will see patients along with the physicians during pediatric genetic or specialty eye clinic appointments at the main hospital to assist with patient care-related errands or any needs that arise, such as transporting the patient to photography or to the pre-op station. Volunteers in this unit need 30 hours of previous volunteer experience at UIHC.
Hi, my name is Amelia. I'm the Student Leader Board member for the Pediatric Specialty Clinic at UIHC. The Pediatric Specialty Clinic is where a lot of kids are going to come to Stead Family Children's Hospital to be seen by a variety of different specialists and also just for regular appointments. Volunteers on this unit are primarily going to work with kids and their siblings in the waiting room and the playroom, which is near the waiting room, helping out with the child life specialists, helping kind of distract kids from their appointments and getting nervous about those, and also just like interacting with them and playing with them. Volunteers will mostly be helping with the cleaning of the toys and maintaining the playroom and things like that.
The Radiology Unit is made up of several different subunits, including CT, MRI, breast imaging, and interventional radiology. Each subunit holds different tasks for volunteers to do during their shift, but some common volunteer duties include greeting and welcoming patients, cleaning, and even making cards for the female patients in the breast imaging center. This position is great for volunteers interested in radiation sciences and nuclear medicine technology, but is open to all majors. It is important for volunteers in the radiology unit to have great communication skills as patient interaction is common. In general, shifts are available from 7 a.m. to 5:30 p.m., with each subunit having specific hours of operation.
My name is Riley Gassell, and I'm the SLB member for the Rehabilitation Therapy Services. Rehabilitation therapy services are broken into 3 different units and include outpatient physical therapy, inpatient physical therapy, and sports medicine. Rehab units will be open Monday through Friday and are a great opportunity for students who are pre-physical therapy or any other health-related majors. In outpatient physical therapy, volunteers will have the opportunity to observe and assist physical therapists with many different specialties. Volunteers are also expected to keep physical therapy gyms productive and safe by cleaning treatment mats, stocking linens, and assisting physical therapists with exercises. Inpatient physical therapy volunteers will be directly assisting physical therapists or occupational therapists during 2-hour shifts from 10 a.m. to 12 in either orthopedic or neurology settings. Tasks may vary from week to week, but can include assisting with exercises, moving IV poles and wheelchairs, and conversing with patients. Patients in these units are often in more critical condition, and as such, inpatient physical therapy is only offered for returning rehabilitation volunteers or those with previous inpatient experience at the University of Iowa Hospital. At the Sports Medicine Clinic, which is located off-site near the Hawkeye Tennis and Recreation Center, patients are typically recovering from sports-related injuries, surgeries, or are looking to reduce pain and increase range of motion and strength. Volunteers assist physical therapists and PT aides by maintaining a clean and safe gym, and will also have many opportunities to observe physical therapy sessions.
Hi everyone, my name is Connor Wettig and I am the SLB for the Respiratory Specialty and Comprehensive Care Unit, or commonly referred to as Rescue. Rescue is a smaller unit which holds a maximum of 25 patients. Prospective volunteers will encounter a numerous set of tasks. The variety of tasks may include assisting staff with transporting and moving patients. At times, the unit may call for a lot of direct patient contact. Volunteers may also be asked to sit, talk, read, entertain, and play games with the patients to keep them company. Some other roles may include paperwork, restocking carts and cupboards, running lab work to pathology, and running errands to pick up supplies. Shifts for volunteers on Rescue are available from 8 a.m. to 7 p.m. Monday through Friday.
Hi everyone, my name is Nathan Steimel, and I'm the Student Leader Board member for the Stead Family Children's Hospital Sedation, Prep, and Recovery Unit. The Sedation, Prep, and Recovery Unit is a small, close-knit unit where volunteers provide support to pediatric patients and their families as they prepare for imaging and procedures. Sedation, Prep, and Recovery volunteers work closely with the nursing staff and aid in discharging and transporting patients, providing activities for children or siblings, cleaning and preparing patient rooms, and various other tasks that make the patients and their families feel comfortable. Volunteers may also observe a procedure while volunteering after having earned 20 plus hours on the unit. This unit is great for volunteers who have a passion for pediatrics, can communicate well with children and their families, and are motivated and independent. Shifts are available from 9 a.m. to 4 p.m. Monday through Friday. And I'm the Student Leader Board member for the Stead Family Children's Hospital Surgery Prep and Recovery Unit. The Surgery Prep and Recovery Unit allows volunteers to provide support to pediatric patients and their families on the day of surgery. Surgery Prep and Recovery volunteers work closely with the nursing staff and aid in discharging and transporting patients, providing entertainment for children or siblings waiting for surgery, cleaning and preparing patient rooms, and various other tasks that make the patients and their families feel comfortable. This unit is interested in volunteers who have a passion for pediatrics, can communicate well with children and their families, and are motivated and independent. Shifts are available from 9 a.m. to 4 p.m. Monday through Friday.
Hi, I'm Olivia, and I am the SLB for the Surgical Specialty Services Unit. On this unit, our volunteers engage in a variety of duties from clerical work to assisting the healthcare team with an emphasis on patient interaction. You'll also help with making beds and walking with patients. This unit offers a different experience every time you volunteer and is perfect for those who are outgoing and thrive on variety. You'll have the opportunity to build meaningful relationships with both staff and patients alike. Dependability is key as our staff works closely with volunteers to ensure the best care for our patients. We're seeking self-motivated, outgoing individuals who are ready to make a difference and get some patient care hours. Volunteers are needed 7 days a week from 8 a.m. to 8 p.m. Thank you.
Hi, my name is Amelia. I'm the Student Leader Board member for the Surgical and Neuroscience Intensive Care Unit at UIHC. This NICU is going to see a lot of different patients coming from a variety of areas throughout the hospital. Volunteers are primarily going to be helping out the nurses and CNAs on the unit, who are going to be working with transporting and maneuvering patients, as well as restocking linens, and helping with the restocking those nurses' stations. Volunteers are going to have the opportunity to also see minor procedures and different things going on the unit to kind of get exposure to those kind of things.
The Women's Health Inpatient Unit at the UAHC focuses on a variety of gynecologic and postpartum and newborn services and care. Volunteers on the unit will help patients from various age groups by performing tasks such as restocking rooms, assisting patients with their basic needs, discharging patients, making breast pump kits, and keeping general order of the unit. Occasionally, volunteers will also help nursing assistants with providing newborn care. Volunteers should have strong interpersonal skills and be motivated to work independently. There are also opportunities to observe medical procedures and shadow staff on the unit. Shifts are available Monday through Friday from 7:30 a.m. to 5 p.m. and Sundays from 10 a.m. to 5 p.m.
Hi, my name's Emma and I'm the chairperson of the Student Leader Board. Our last placement is the Volunteer Services Office, or the VSO. The VSO provides a highly unique experience as it serves as the central hub for all volunteers throughout the entire hospital. This is a high-traffic, upbeat, and productive environment which offers duties such as delivering gifts, floral arrangements, and letters to patients, and assisting with special projects that helps departments serve patients across the hospital. You will definitely be getting your steps in. The VSO provides a fun atmosphere as you may get to know other experienced volunteers and receive mentorship. Also, the office often has furry friends therapy dogs stop by, and they always have candy and snacks available for volunteers every shift. Volunteers must be highly driven, independent, and reliable. The VSO provides great shift availability, which is 8 a.m. to 5 p.m. Monday through Friday.